Hi, my name is Andrea Furlan. I am a pain specialist in Toronto, Canada, and I have this channel to talk about chronic pain with you, people who have chronic pain. And many of you have asked a lot of excellent questions, so I'm making this video today to answer your questions. In fact, there was a group of patients in Kingston, Ontario, who got together and they watched many of my videos and they sent me a list of their questions about the videos and about chronic pain. So I'd like to read them here today and I'll see how many I can answer in about 20, not more than 30 minutes today. So I'll start with a few questions, and so actually the first one is not a question, it's more like a comment. They say that all the participants in this pain group agreed that my introductory video entitled Chronic Pain, I think they were talking about this video, should be required viewing by all medical professionals, who should then in turn recommend it to their clients or patients. How can we make this happen? So thank you very much for proposing that. I don't know how to make that happen. I'm doing my best trying to promote these videos. I think people really resonate with that video that I explain what is chronic pain, because I talk about pain being a disease on itself. We know that chronic pain is a disease of the pain system, a malfunctioning of the pain system. And people should not be treating chronic pain the same way that they treat acute pain. A person may have chronic pain and then develop acute pain on the top of that, but chronic pain is a disease on itself. And many patients don't know about this, and even healthcare professionals don't know about this. What this disease is basically, I talk about in this video that chronic pain is a disease of the alarm system of the body. That we are born with this alarm system that is there to protect our body. It's called the pain system. It's like the alarm system of a house. And when this pain system is malfunctioning, there is this noise, there is this alarm going off all the time. And it's like a house that the alarm is making a lot of noise, and you call the ambulance or you call the fire truck. They come. They check all the sensors, they say there's no fire, there's no smoke, and they leave, but you are still hearing the alarm is still going off. This is what chronic pain is. You are still feeling pain, but then there is no test, no blood test, no x-ray, no MRI that will show anything wrong. It's because the pain system, the alarm system is malfunctioning. We need to fix the pain system. So the way we treat acute pain is different from chronic pain. Acute pain, we treat like if there is a fire in the house, you go there and you put up the fire and the alarm goes off. It stops making the noise. So acute pain, if there is a fracture, tooth pain, a appendicitis, then you treat that thing and the pain goes away, it stops. With chronic pain, it's not the case. You need to fix the alarm system. So thank you for making that suggestion. I'm trying to make that happen, and let's see if we can work together to make this education available to all healthcare professionals in primary care, specialists in emergency departments, and I am helping to disseminate this knowledge by creating those videos. So question number 2, how can I speak to my friends and family about my pain when they are generally not supportive? I understand. Many of my patients talk about that chronic pain is an invisible disease and it causes an invisible disability. And the family, the caregivers, the friends, and even the healthcare professionals will not believe that you have chronic pain because they can't see anything wrong. They test you and everything is all right. Unfortunately, again, I think this is related to the answer that I gave to question number 1. We need to do a lot of education. We need to teach healthcare professionals and the public in general that when the person says that they are having pain, they're having this disease of the pain system, there is treatment, but they have a real pain. And we need more education and more dissemination of this knowledge. Question 3, how can I maintain intimacy with my partner when my libido is often wiped out by pain? Yes, chronic pain, because it's a disease of the pain system. The pain system also involves the neuroendocrine system. So all the hormones may be affected because the pain system is linked with those areas of the brain that control the sex hormones. And this is true for both male and female. But also there are many medications that we give to treat chronic pain to fix the pain system, and the side effects of those medications will be low libido. Actually, almost all of the medications that we use will have some effect on the sex hormones and libido. So sometimes it's just a matter of changing the medication, reducing the dose of the medications, and that helps. But if it's not the case, if it's just the disease of the pain, because chronic pain affects the areas of mood, sleep, concentration, memory, so the brain is almost overwhelmed all the time, the person may not have libido at all. So if this is your case, there is treatment for this, there are therapies for this. Talk to your healthcare professional, and there are some medications, there are therapies, there are mind-body therapies, and also communication with the partner. So bring the partner to the medical appointment so then you can work on solutions together. Question 4. What can I do if my family doctor either doesn't believe in chronic pain or doesn't seem interested in learning about it? Yes, chronic pain is a disease that was not taught in many medical residencies. Family medicine, they rarely learn about the disease of chronic pain, this thing that I just explained about the alarm system of the body. They don't know that chronic pain is a malfunctioning of the pain system. So if they don't know that there is a disease, they don't even know how to treat, and they try to treat chronic pain the same way that we treat acute pain, and it doesn't work, and people tell them, don't do this for chronic pain, don't do that, and they are not, I would say that not that they're not interested in learning about it, it's also, there's not a lot of places that people can go and learn about chronic pain. We need to improve and create more courses and strategies for them to do this. I have been teaching family doctors, nurse practitioners, people who work in primary care about chronic pain for the past 6 years. I run a Project ECHO that is funded by the Ontario Ministry of Health, and we use telemedicine. And every week, myself and my team, I have an interprofessional team that work with me, and we are in front of a camera, and we are discussing cases from family doctors, nurse practitioners, that they are seeing chronic pain patients in all areas of Ontario. So they are learning about chronic pain, those who come to our sessions, of course. So more people need to come to our weekly sessions to learn about chronic pain. Question 5. What can I do to reduce the bias and stigma I encounter regarding my stable and successful opioid treatment for my chronic pain? This is a big problem, and this person also adds, in the emergency department, when there is a new acute pain, for example, if a person who is on chronic opioid therapy, they are doing well, they have been successful, if they have an acute pain, because of course a person with chronic pain may have a toothache, a fracture, an appendicitis, a new pain, and they need pain management as any acute pain would need. But when they go to emergency, there is this stigma that they are drug seeking, that they are there for the drugs, to increase the opioids, they're addicts. This is really bad, and we need to reduce this stigma, this bias towards patients with chronic pain, especially those who are doing so well in chronic opioid therapy. Also, there is a problem when the doctor retires or the doctor takes maternity leave, paternity leave, and a new doctor comes and they look at your file and they see, oh, you are in there's so many opioids, we need to do something about it. But they don't know all your past history, everything that happened to you before, how you got there, and now you are stable, you don't have any complications of the opioids, there is no need to change that. I created another video that's called about opioid tapering, and in this video I say not everyone who is on chronic opioid therapy needs to be tapered, or the dose of the opioids need to be reduced. So yes, there is still a lot of way to go. And I know the opioid crisis has not helped. I also have a video that I explain what is the opioid crisis. But basically, it has been there was a lot of prescription of opioids 20, 30 years ago. Then a lot of people were exposed to opioids for acute and for chronic pain. And many of those people actually did not need those opioids for pain. But what happened was they created a strong physical dependence on those drugs. And many of those developed opioid use disorder or addiction. And when the doctor stopped prescribing their medications, then they had to go to other sources, and sometimes illicit sources and not so trustful sources. They don't know what they're getting, and they may get a fentanyl on the top. They may think that they are buying a tablet of opioid on the streets, but that may be much stronger, and they may die of an overdose. So a lot of people died in North America because of overdose of opioids. And many of those people were introduced, their first contact with an opioid was by a prescription from a doctor. And maybe one prescription, they liked the effects, and then they wanted to keep using that. So because of the opioid crisis, there's a lot of stigma and bias against people who have chronic pain and need opioids if they are on stable drugs and they don't have any complications. Unfortunately, that's a side effect of the opioid crisis, an unintended consequence. Okay, so question 6 is, in Ontario, how can I get a new doctor when I'm deemed to be a complex case? Yes, complex case here, I don't know what you mean by complex case, but it might be because you have chronic pain, some mental health comorbidities, which is very common with chronic pain because it's a disease of the pain system, and the pain system is inside of the brain. So the chronic pain also affects the areas of mood, anxiety, sleep, concentration, memory. And so mental health are usually very common with chronic pain. And also it might be because they looked at the number of medications that the person was using. The number of medications, could be a lot of opioids and other medications, so they were deemed a complex case. Well, that's not acceptable. I know that the College of Physicians of Ontario says that patients cannot be denied to have a primary care provider because they are a complex case. They need they need more a primary care provider than anyone else who is not a complex. So sometimes the doctors will do an interview, they will review the chart, the file, and they say, oh no, I cannot take you. Well, that's very unfortunate. And again, we are here, we have this Project ECHO to help people in Ontario, the healthcare providers in Ontario, to get knowledge, to get support, how to manage complex cases of chronic pain. We know that they exist, but they need care, so they cannot be denied to have a family doctor. Question 7 is about the topic of active versus passive treatment attitude. So how some people that have this question, I just want to find the right doctor who will know the right medicine to make my pain go away. That's a very passive attitude. They expect the healthcare provider, the doctor, or the physiotherapist, or the nurse, whoever, to take their pain away. In chronic pain, this rarely works because we need to work in partnership, the healthcare provider and the patient. There are a lot of things that the patient can do. We call this self-management strategies. I call this the toolbox of strategies that you need to have. I talked about this in the video of chronic pain, that you need a toolbox, and each day or different times of the day, you use a different tool from your toolbox. And these tools can be medications, yes, but there are movement, exercises, mind-body therapies, modalities, manual therapies. I call this the 5 M's. And so you need to learn about your tools, what work for you, what work for your pain, and I can be your partner in your journey to help you with your chronic pain. But this passive attitude that the patient doesn't want to do anything and is expecting the provider to do everything for them and their pain go away, it's rarely achievable for management of chronic pain. It usually doesn't work. Okay, question 8. What are your top 10 best ideas or suggestions for someone with chronic pain? Top 10. Okay, I think there are things that I like to say, things that you should be doing and things that you should not be doing. For example, we just mentioned this, don't be a passive patient that expects your healthcare provider to do everything for you and you don't need to do anything. So you need to be an active participant in your care. You need to learn about your pain, your disease, your condition, ask questions, read about it, watch more videos, ask your doctor to give you more brochures and pamphlets and education. And then you have to have a strategy, your toolbox. What do you do if your pain does this? What do you do if your sleep is not going well? What do you do in a bad day that your mood is low? You need to have those tools around you in your toolbox. Use those strategies actively. Ask questions to your healthcare provider. And regarding the medications, a question about your medications. Do I need to be on these medications? What is this medication doing for me? Ask your pharmacist. Your pharmacist is probably your best ally in your community. They know a lot. They want to help. They like to help. They are paid to help. So ask your pharmacist about the medications you're getting, and they can also help you with over-the-counter medications, things that you don't need a prescription, that can also help you to manage your pain. Another ally that is very, very important is someone in the movement world, someone that will help you to move, exercises, exercise-based therapy. So this could be a physiotherapist, an occupational therapist, a chiropractor, a kinesiologist, a personal trainer. Ask someone that will give you a routine of movement exercise, because we know if there is one thing that helps chronic pain to fix the pain system, is movement-based therapy. Another strategy that we know helps to fix the pain system is cognitive behavior therapy, acceptance commitment therapy. Those are in the mind-body area and field. So again, find someone, could be a social worker, a psychologist, a psychiatrist, a mental health counselor, that will help you to use techniques for your brain to fix itself. That's true, that helps. And there's a lot of evidence that mind-body therapies help to fix the pain system. Combined mind-body and movement therapy, they are, if you're doing those two things, that's the best thing you can do for to fix the pain system. Okay, we have a few more minutes. I think I have time to answer one more question. So question 9, when using a multifaceted approach to chronic pain, how can I be sure what is working and what is not? Similarly, if I have been on a particular pain reliever or anti-inflammatory for years, is it safe for my kidneys and my liver? How can I tell what is an acceptable level of risk? Okay, those are good questions. So what is working, what is not working? How do you know? Yeah, it's really hard to know, especially if your chronic pain started over the years, over so many years, and you can't actually remember how you were even without chronic pain. And now that you are chronic pain, how do you know if the therapies that you are receiving are helpful or not? Well, for anti-inflammatories and over-the-counter medications, these are usually easy to find out if they work or not, because when you don't take them, you know how your pain is, and when you take them, you know how helpful they are, okay? Now, for opioids, for antidepressants, for anticonvulsants, those are the medications that we usually prescribe for chronic pain, they don't work the same way. So what happens is, if you stop taking an opioid, and you want to see how your pain is without the opioid, of course it's going to be horrible, because if you stop the opioid, you're going to have physical withdrawal symptoms. Your body is already, everybody who takes opioids on a regular basis every day, when they stop, they're going to have withdrawal symptoms. Okay, and those withdrawal symptoms, sometimes they're horrible, and you're going to feel really awkward. You're going to have a lot of withdrawal symptoms, including agitation, insomnia, nausea, vomiting, diarrhea, abdominal pain, muscle aches everywhere, headaches. So you're going to feel horrible. It's like a big cold, like the worst flu that you had in your life. So it's not a good test. How do we know if your opioids are helping you or not? We need to taper the opioids very slowly to avoid the withdrawals. And then once you are on a lower dose of the opioid, or you have no more opioids in your system, then we can assess if you still have pain or not, okay? The same thing with antidepressants and anticonvulsants. You cannot just simply stop taking them and see how your pain is. You need to taper slowly, and once you are not taking them anymore, you can compare. And we use questionnaires, we use some instruments that measure pain and function and quality of life, and then we can measure how you were, how your pain was and your function was when you were taking those medications, and how you are now that you are not taking those medications. But please don't stop them abruptly, because then your body is going to suffer those withdrawals from medications, and you're going to feel horrible anyways. But the second part of this question was, how do you know if it's safe for the kidneys and liver? Yeah, you don't know. Actually, just by looking at a person, we don't know if their liver or kidney is functioning well or not. We need to order some blood tests, and ask your doctor if they have been doing the blood tests to test if your liver and kidneys are working okay. There are some substances that we measure in the blood, in the plasma, and then we know if they are high or low. We know that the liver is working okay. One of the medications that really cause damage to the liver is acetaminophen, paracetamol. And if a person is using too much acetaminophen for a long time, we need to check the liver function. If the person is taking anti-inflammatories, non-steroidal anti-inflammatories drugs, high doses and for a long time, they can damage the kidneys. And again, there are substances that we measure in the blood to see if the kidneys are filtering the blood properly, or if the kidney is starting to have some damage. We call this kidney failure. Okay, I think we answered 9 questions today. I hope you enjoyed. I'll keep doing this more on a regular basis. I'll try to answer more questions next time. Thank you so much for sending your questions, comments. If you have more questions, please write them in the box below. I really enjoy reading your comments. It's one of my favorite times of the day, when I open the comments on YouTube and I read everything that you have written there. And please remember that I don't provide medical advice via the YouTube channel. This is only for education. My intention with this channel is actually to help people with chronic pain to improve their health literacy, so they know more about their diseases, about the treatments, and then when they go talk to their doctors, their nurses, their therapists, they will be more knowledgeable about the language, about the interventions that the doctors will offer to them, and they can have a more intelligent discussion. So my goal is to improve your health literacy, that you will be knowledgeable, that you can talk to your doctors and even teach your doctors and your healthcare professionals if they don't know about chronic pain. So remember, this video is not intended to provide any medical advice. It's only for education, and if there is any emergency, please go to the nearest emergency hospital. If you like this video, don't forget to give a like and also to subscribe to this channel. I really hope you like it. You can also find me on Twitter, Facebook, and Instagram. Thank you so much for watching today. I hope you enjoyed, and I hope to see you again for another video of questions and answers. Bye!